So, Delta is really what everybody's talking about, the Delta variant. So I thought I'd start with just sort of a very brief overview to remind people how viruses work. And then we could talk a little bit about how Delta is different than the original variant or the original coronavirus that we started off talking about. As you said, so much has changed as we've done these town halls over time. And the Delta variant is sort of the current change that we're all trying to manage around. So viruses replicate by hijacking host cells. They're not like bacteria. They can't replicate on their own. They need to invade a host cell and take over its replication machinery to make copies of themselves that can then go on to infect other cells and spread to other people and continue that cycle. So in order to do that, viruses have to bind to the surface of a host cell. And different kinds of viruses bind differently to different types of cells, and they may prefer the lungs, the GI tract, et cetera. So these are respiratory viruses. They tend to prefer the cells that line things like the linings of your airways. So that's why this type of virus tends to cause respiratory symptoms. But for it to do what it needs to do to perpetuate its life cycle, it has to bind to the surface. So many people have kind of heard about the spike protein, right? That's sort of something that the coronavirus has that needs to bind to the surface of the cell, right? The antibodies that we produce against the spike protein and the vaccines that help you produce antibodies against the spike protein are what provides some level of immunity against coronavirus. So the difference between the original coronavirus and the Delta 19 variant is largely in that spike protein. It's slightly more effective, it's able to bind more easily, it's a little more flexible, and it may have some level of masking that helps disguise it from the body's immune system. So there's always this back and forth battle. The virus sneaks in, replicates quickly, and gets out. That's a more successful virus. If it comes in and the host is prepared and antibodies attack it immediately, it's not going to replicate quick enough to spread and continue its life cycle. So those are kind of the two balancing factors, immune system versus virus. So the Delta variant is able to bind more easily, replicate more quickly, and allow it to spread to others. So that's what sort of you've heard about that twice as contagious stat that's out there. The reason it's able to do that is because it gets in quickly, replicates quickly, and allows that viral load to then potentially spread to someone else. Same kind of thing, right? You cough, sneeze, all the things we've talked about. It takes less of that viral load to infect someone else and continue the cycle. So that's what's different about Delta. It makes it more contagious. We don't know enough yet to know whether it's definitively making people sicker. Early data suggests that it may be. So there's not enough data yet to really determine that conclusively, but it's looking like it's going in that direction. It's likely that it's going to show that the Delta variant not only is more contagious, but may also be a little bit more symptomatic in terms of the disease that it causes. So that's what's different about Delta. Now, Delta is one of many variants that have come along. Many of the previous variants had slightly different makeup to their sort of genes, essentially, right? That's how viruses mutate over time. When they invade a host cell, make a bunch of copies of themselves. If one of those copies is a little bit different, that's a new variant, right? Now, maybe it's more successful, maybe it's less. If that new variant is better at spreading, replicating, and invading, then that may be the new variant that comes along. And that's something we'll talk about over the course of this morning. That's kind of the fear for what could happen if we don't get this under control, right? The Delta variant now is more successful than the original. And by successful, I mean able to replicate and spread. Who knows what the next variant could look like as Delta continues to spread. And every time it spreads, that's a new host, that's new copies, and more chances for a variant to emerge. So that's what's, that's sort of the main underlying driver for why Delta is more successful and scary from a healthcare perspective.